Hi, good afternoon, everybody. Welcome. Thank you for joining me today for our conversation, Caring for Our Elders, Seniors, and COVID-19. My name is Lisa Labus. I'm midday host at WBEZ. We're going to spend our time together talking with some senior members of our community about the effect the pandemic has had on their lives and what needs they see in their communities. And then we're going to take your questions. We will send those questions to our panel of experts in physical health, mental health, and senior services. And you'll be able to leave a question for any guest in our comments section while you're watching, and we'll get to many of those questions as we can. So to start off tonight, I'd like to ask you a question. What are you most looking forward to once it's easier and safer to gather with your neighbors, your friends, your loved ones? Let me know right there in the comments. And like I said, we're going to start out talking with some local seniors. But first, I thought I would check in with my own mother, Elaine Labus. I spoke with her earlier this week. She's been renting a condo in Florida, but she moved to Chicago on her own. The plan was for my parents both to move, and then my dad passed away suddenly in June last year, not COVID related. But now she's moved on her own and she's been spending a little bit of time in Florida. So here's what I had to ask with her. Here's our conversation. This has been a very difficult, challenging year for many people, but I want to see how you've been doing. Give me a couple of words, 2 or 3 words to describe how the last year has been for you.
Well, the last year has been pretty much frantic. It's been extremely busy. I have 2 more than 3 words. It's been frustrating. And then when, August or September came, it began to be lonely for me, because up until that point, I had a lot on my plate that had to be done, just had to be done. And so I kind of took a deep breath in August and September and thought, I'm alone. I'm in a city I've never lived in before. And I'm pretty much isolated as everyone else was. And so that was quite a challenge at that point.
And even though we live, a 2-minute drive apart, it was lonely though for you.
It was. I mean, the days are longer, mostly because I depend a lot on volunteering. And I wasn't able to access any of that when I moved into Oak Park because there were no opportunities available. Everything was shut down. And so the days were long. I do my walking and my exercise in the morning. I do the crossword puzzle. I did all those things. And then came noon and I thought, now what? And so that was the part that was more difficult to deal with.
Is there something that you need right now that you wish you had? What do you need right now to feel better?
Right. Well, physically, emotionally, financially, I feel I'm very secure. I'm very happy. I would think, like everyone else, of just more interaction with friends. That's picking up, especially here in Florida, where we can eat on a patio, spread out. We weren't doing that when I left Chicago. That was going out. I was figuring out my budget before I left Chicago, and I had everything itemized, and I got to eat out. I wrote or entertainment if only. I mean, those were kind of a big zeros in my budget. I didn't have to plan for those. And so I don't think it's a surprise to anyone that, being alone, I am sure, is a big challenge for a lot of people. I have friends who have lost spouses and just can't handle it. I think I'm doing fairly well in that regard, but being alone because of the virus it's not unique to me. And, it's common. It's very common. So if I could change that, and things are changing, I've had my shots, I've had been vaccinated. So I'm hoping that slowly but surely we'll all get back to a new normal. I think it'll be a new normal. Well, thank you very much for joining us, Mom. And I will see you very soon. You're coming back up to Chicago. I think it's 3 weeks from tomorrow. Yeah. Love you, Mom. Love you, Lisa. Bye. Well, I'd like to introduce our first guest, Devetta Brooks, and we met Devetta through the Jane Addams Senior Caucus. This is a grassroots organization led by concerned seniors from the Chicago area. Devetta, thank you for joining me.
Thank you. I'm glad to be here. Thank you.
So I hear that before COVID, you were the DJ, the go-to DJ for celebrations in your building. Is that right?
I love it. That makes me happy. Yeah.
What kind of music do you like most?
All music, all music, country, blues, R&B, reggae, all music.
All right, if we were going to have a party right now, what would you pull out? Give me one album.
Stevie Wonder.
All right, all right. Excellent.
Anything by Stevie.
So you live in a public senior housing area on Chicago's near west side. Can you tell me a little bit about your building and your neighbors?
Yes, it's I actually live in, and it's ironic. This is the irony of it. It's the name of the building is Congressman George Collins Senior Apartments. And that would seem as though, oh, that ought to be nice. It's named for, but it's not too good. It's low income. I'm I appreciate that I'm able to have subsidized being subsidized with my rent, but it's not ideal. It's not what it may appear to be.
But if you're the go-to DJ, you must be close with your neighbors. Tell me about a few of your neighbors. What are they like?
Well, with the one thing we have in common, we're all low income, and with that comes, a mixed bag of everything. People, it's not so much the income, it's just people who have issues and together, and my mama used to say water seeks its own level, or I guess some people would put it, birds of a feather flock together. So people find, just like in high school, you find your little cliques and you're comfortable in it because like-minded people are together, and that's what happens here.
Tell me a little bit about what the last year has been like for you.
Terrifying.
Yeah.
Fear. It's it 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 was more than I can put in words. Things, way things began developed, it was frightening. I live, it's a huge building. It has 195 units, apartments. And I live in the front of the building, so it's facing the parking lot. And when you're looking at television and you're seeing the news saying nursing homes are being, and then I'm hearing ambulances pull up, and then it's no communication for management. It was anxiety, it was fear, all every emotion you could name.
What kind of services do you think that people who live in your building need that are not available right now?
The thing that's most needed, a social worker or service coordinator, however but to see seniors in during this pandemic when everything was shut down, and they may not have been able to uh, get services, or it was people here that their food stamps were cut off because they couldn't recertify because the public aid office was shut down, and they couldn't navigate the system to couldn't access the system.
Mhm.
I helped as many people as I can, but I have macular degeneration. I'm not even seeing as good as I could to help. It's it's bad.
Yeah.
It was frustrating. It was hurt, and then to see the people sick, and the management, uh, the management's not good. We prior to the pandemic, we had formed an association in the building because the conditions were so bad. And then when the pandemic hit, and we requested a meeting with the corporate management, inform them you're not protecting your work, your staff, let alone the residents. They don't have masks or gloves, aren't sanitizing, doing it. We were just shut in our apartments. I was afraid to go out in the hall.
Mhm.
It was dangerous.
Were you able to reach out to your neighbors down the hall at all?
The ones that we would somebody I call the people I know and tell them to put their phone numbers, the one I didn't have their numbers, at my door. We kind of pulled together more so than because it ended up the management staff, they had to close the management office because and quarantine them because they were infected.
Mhm.
That scared everybody. And we kind of formed little chains of communication in that ways, people reaching out to each other. But it was like a tune. It was quiet and it was scary, and you hear an ambulance and then you don't know who's people died in their apartments. And
Right.
it I get emotional thinking about it. I'm telling you, it was a lot.
It absolutely sounds overwhelming.
Yeah.
What what are you looking forward to now?
I'm belong to the Jane Addams Senior Caucus, and we're working on campaign on a housing campaign to get the buildings. They're poorly maintained. I mean, really, we were able to get some services, extermination, and now they slow walkers, and I'm looking forward to uh, our us residents getting together and just confronting management. You have to do this. Right now they have the cover of COVID because they can't come in your apartment unless it's an emergency.
Mhm.
But we have seniors here who have lived here 20 years, never had their apartment painted or carpet removed or cleaned. It's bad.
It's bad,
Yeah.
very bad. What do you what else do you need? Do you need more help from the city or other groups of people to come and help?
Well, it's no this building, it's you have in senior buildings, you have Chicago CHA, Chicago Housing Authority, they have senior buildings. But
Mhm.
this building that I live in is privately owned and privately managed. And they just do how they collect the rents and they get their subsidies from their payments from the government, and that's all. And they do the bare minimum, not even it.
Tell
And
me
it's
uh,
oversight. Somebody,
needs to be in charge.
yeah, because seniors intimidated, afraid to say anything because they be afraid of being, evicted.
You worked to help get the Chicago City Senior Safety Ordinance passed.
Yes.
Tell me a little bit about that ordinance.
Well, the when we drafted it, in drafting the ordinance, we were just in meetings, when people were saying, when we would say what was going on in our different buildings and everything, and we kind of drafted things to that would help that. The main thing was wellness checks because with people dying in their places and you not even know it for a couple of days. They don't even didn't even know for a couple of days. A wellness check would help that. And we lobbied for, they negotiated. They negotiated how many wellness checks would be done. And I'm saying you negotiating about the wellness of people, and it ended up they could have two wellness checks they call and say, "How are you?" And most seniors gonna say, "I'm okay," and that's it.
Mhm.
They, they might need their medicines. They might need assistance getting to the doctor or whatever. It's that's what it ended up being. But we were able to, in the ordinance, that the management companies have to do the proper maintenance and proper cleaning, and and it was some response with their responsibilities. It was accountabilities that was included.
Mhm.
But the wellness checks, I was asking, I was in on the negotiation, and I'm saying a service coordinator. When you have people that can't even get a ride to the doctor, or to the Social Security, or even go on the Social Security website, that's bad. And they're left with, I help as much as I can. I'm not a surgeon. I can't even see. And they did suffer a lot, and but we kind of pulled together.
So are things looking in relation to meeting with your neighbors and staying connected with the people in your building? Have you been able to get a little more connected and a little closer now that the vaccine rollout is happening?
Yes, um, uh, the we were able to get them to come to the building because during the time when they were getting vaccinated, we were saying that people were having problems trying to access, let alone get the vaccine. And so I just said, well, they could come here. It's 195 people. I'm in a wheelchair and I got macular degeneration. I can't go out to there.
Mhm.
And not just me, it's a lot of them are shut in. So they were saying, well, how did you vaccinate the people in the nursing homes? And a mobile unit, but they did. They did get a clinic to come out and vaccinate us. But people are coming to we're coming together, uh, as far as trying to get the things that's needed here.
Mhm.
Uh, just you got people here with respiratory problems and carpets that's been on the floor for 15 years. Doctor statements.
Mhm.
They don't even they do nothing.
Yeah. Well, I want to thank you so much for spending some time with us this afternoon, Devetta, and I hope that things are looking up for you, and I hope your neighbors get the help they need too. And thank you so much for your time.
And thank you. And with the Jane Addams Senior Caucus, they're helping us to organize and do the ask that we need, and try to get what's needed here.
Well, take care. I hope you're
Thank you.
DJing soon again. Soon
Thank you.
again.
Thank you.
Right. All right. I would like to now move out to our panel of experts who will be answering your questions. First, I'd like to introduce Dr. Linda Ray Murray. Dr. Murray is the retired Chief Medical Officer of the Cook County Department of Public Health, and she also teaches at the UIC School of Public Health. Dr. Murray, thank you so much for being here.
It's my pleasure.
Our next guest is Dr. Robert Schulman, who chairs the Department of Psychiatry and Behavioral Sciences at Rush University and specializes in geriatric psychiatry. Welcome, Dr. Schulman.
Thank you.
And last, we have Diane Slazak, who is CEO of Age Options. This is a nonprofit organization that serves and connects older adults in suburban Cook County with services and resources. Welcome, Diane.
Thank you.
So our panel, again, here to answer your questions. You can put those questions into the comment thread, and we're going to get to as many as we can with the time that we have. We'd also like to collect your recommendations, if you have any, for services and organizations that support seniors and caregivers. If you have a recommendation, please let us know in the comments. We're going to compile them all, and then we'll have all those suggestions put together, and we'll make it available for everybody after our conversation today. So ask us questions, give us recommendations. We want to hear it all. I'm going to start with a question for Dr. Schulman first. We heard Devetta Brooks on and the video with my mom talking a little bit about the loneliness and the fear of contracting COVID, the fear of, just being in an environment that's unsafe and scary. What effects have this extended period of social distancing had on older adults' mental health and well-being?
It's an excellent question, and the data, interestingly, has some conflicts in it. Early on, much like anybody who's in a crisis mode, people adapt. So there was actually data suggesting that in some ways, older adults, or mature adults, as I like to say, mature adults actually, because they have sort of life experience, deal a bit more resiliency in many ways, and actually managed the early stages of the pandemic relatively well as compared to other age groups. Now, this is just a general statement. It doesn't obviously apply to everybody, but I think older adults, mature adults have this sort of sense of who they are, a sense of competency, and were able to navigate the early stages. I also think that people were able to adapt in many ways, and families were able to adapt in terms of making sure that their loved one was being taken care of in some ways. And in some ways, perhaps they received more attention from family and others early on, because everybody's concerned for older adults as it's sweeping through the older age group communities as COVID was sweeping through. So I think there was the anxiety about getting sick, the anxiety about being lonely, but in some ways there was adaptation early on. With the extended sort of limitations and the extended loss of human contact, loss of touch, loss of physical warmth, I think that has taken a toll on individuals. So the early resilience, which was very helpful, in some regards, it's been caught up at this point, and everything that we sort of thought about what would happen with older adults with isolation has caught up. And there are other studies pointing to that the prolonged isolation is taking its toll in terms of depression now and anxiety and such.
Right.
I think that there are differences as well in different communities that have differences in resources, obviously, and I think that people who have intact families and closer family relationships have done better. In olden times, there were multi-generations in one household. I think, that
people lived close by, didn't they?
They did, and that was helpful. But it's really sort of the under-resourced, mature person, who will band together at these times of stress. But I think isolation does take a toll.
Yeah. I do have a listener question for you, Dr. Schulman, from a woman named Kate, who says, my 82-year-old mother lives alone, and in recent months, her memory has declined considerably. And when she showed the very first signs of forgetfulness, her primary care physician gave her the quiz, what year is it? Who's the president? And she passed that, and he sent her on her way. And now my mom forgets what she ate a few hours ago and much more. What is the next level of assessment, and who can provide it? What other questions should Kate be asking?
So the next level of assessment would be neuropsychological testing. First, the primary care doctor can, do a screening for the common reasons for memory problems. There are certain medical conditions that can interfere with memory functioning. Anxiety, by the way, is a major interference with memory functioning. And what we see with older adults who start a cognitive decline, one of the treatments equal to what medication can do is social interaction and brain stimulation. And if that's lost because of isolation and the restrictions, then it becomes harder. But I think a good screening from the medical doctor, the primary care doctor, the next step is really to examine brain functioning via neuropsychological testing. Either the primary care doctor can make a referral. Most of the university medical centers in the area have testing centers where this can happen. We certainly have that at Rush, and all the other medical centers have that as well.
What about some questions that Kate might want to ask, any medical professional or caregiver?
In terms of how to handle mom or what comes next?
Right. Yeah. What's coming next?
Well, what's coming next is first figuring out what's going on. And then you can know what's coming next. And there are, if it is going to be a slow, degenerative kind of thing, that there are resources in the community. Ms. Lazak can certainly fill us in on those sorts of things in terms of enhancing social interaction, enhancing care in the home, what sort of options there are for medication management, activities, all the things that one needs to do in taking care of one's parent at this point.
All right. Well, thank you for that answer. And Diane, let's get to you next. Your organization is called Age Options. It's the Area Agency on Aging for Suburban Cook County. Give us a quick explanation of what the Area Agencies on Aging are.
The Area Agencies on Aging were created under the Older Americans Act. We've been around for over 40 years, and we are the main recipients of Older Americans Act funds at the federal level. And then we have about 70 different partners throughout suburban Cook County, in our case, that deliver a wide range of services, including meals, a lot of social services. We have pivoted during the pandemic, and I can talk to you about some of the services that we've created in order to combat social isolation. But there are 13 area agencies on aging in Illinois, and our area covers the 550,000 older adults within suburban Cook County outside of the city. And then the city of Chicago serves its own area agency on aging. So wherever you go in the nation, there is an area agency on aging. And if you Google on that for your area or on the elder care locator, you can find these resources where you live.
Okay, so residents in suburban Cook County can reach out to Age Options, and we're going to drop some information on how you can get in touch with that in the comments. Chicago residents, as you mentioned, served by the City Department of Family and Support Services. And yeah, you can find your area agency on the U.S. Administration on Aging's Elder Care Locator. Of course, we're going to give you all links and phone numbers for all of those resources in the comments. But we do have a question for you, Diane, from one of our viewers who says, I feel we need to rethink how we care for our loved ones. My mother and sister have been in a skilled nursing care facility since the pandemic started. I've seen the effects of isolation as they've both deteriorated emotionally and cognitively. And many of the facility's residents could have their health conditions managed in a home setting where they'd also perhaps have a more social and emotional, their needs met that way. And the listener asks, could this be a moment when we reevaluate how to deliver elder care?
Yes, so we have been working on rebalancing care and trying to balance it more in the direction of home care for the whole 40 years I've been involved in aging. And at Age Options right now, we do have a program called the HOPE program that was created under the Colbert and Williams decrees. And we're actively working to identify those people who are living in skilled care facilities and move them back into the community. That's been much tougher to do during the pandemic because, of course, we haven't been able to go into many of the facilities where there's been outbreaks of COVID. But we have a robust program to set up to evaluate them, to make sure that they can live back in the community and to try and and rebalance it in that direction. The Older Americans Act was created also to keep people at home as long as possible. And right now in Illinois, we are advocating for a program to better support family and unpaid caregivers, because they're our front line. I mean, they provide billions, $18 billion worth of care of older adults in the state of Illinois. So those caregivers are really the front line even before any kind of providers, just like your callers are. So we're advocating to add some state funding to keep those caregivers in place at a higher level longer and to really support them. They've been really hit hard during the pandemic, and thinking about being at home with someone who is a grandparent raising grandchildren or who's taking care of somebody with progressive dementia, what a difficult position they've been in, shut in a house for the whole year, caring for someone one-on-one and afraid to let a paid caregiver into the home for any respite. Those are some of the toughest situations that I've seen.
If some of those changes were made that you're advocating for, though, do you think that we could be meeting more elder care needs with in-home care?
I do. I mean, we know that there are people living in facilities right now who don't necessarily, at times that is the best placement, but there are people right now living in facilities that we have identified. In the last 6 months, we've moved just 10 people back into the community, but we know that there are many others that kind of get stuck there. They'll go in after some kind of surgery and stay there for a while. And sometimes it just gets harder and harder to get back into the community.
Mm-hmm.
So, yes.
That's good. Dr. Murray, we're seeing a lot of questions about what is safe right now for seniors. And we have a question from Anne, who says that she is fully vaccinated and wants to know if it's all right to have an unvaccinated person come provide help with housework. They would be inside with me for about 2 hours. Are there precautions we should take, or should I hold off on getting this help until they're vaccinated?
So this is a pandemic that is moving and changing quickly. I wish I could give a clear, safe answer. I think you really have to be thoughtful. I want to refer people to some of what Dr. Fauci has said about this. So let me give some examples. If this is someone that you have, first, are they vaccinated? If you pick someone that's unvaccinated, I might wait a little while, to be honest with you, but you have to find a comfort level that you're comfortable with as a person. There are lots of things we don't know. We don't know to what extent people that are vaccinated may still transfer the disease. We don't know what variants. We know new variants are out there and new variants are coming right now. From what we know, the vaccines cover the present variants that we're aware of. That may change in a few months. I'm not trying to scare people. So I think people have to be thoughtful and cautious about how they reintegrate. And you might start off with, having coffee outdoors with a friend or something, in terms of people's addressing their mental health that we've been talking about. I will say this, that, and I think Sister Brooks said it most clearly, the problems that exist before coronavirus still exist, and the pandemic just makes the problems more acute. So fortunately, most people that are elderly are not in an institutional setting. Still, huge numbers of them live with their families. But in each situation, you have challenges that are exacerbated by this incident. So for me personally, I will say this. I'm 72 years old. I historically have had someone come in and help me clean. I just stopped it, and I'm not in a hurry to restart that particular activity. On the other hand, I'm looking forward to going out and meeting some of my friends that are also vaccinated for just a coffee outside somewhere.
Absolutely. And related, we've got a question to you, Dr. Murray, from Andy in Uptown, who says, I moved my 75-year-old father from Indiana to Chicago about 8 months ago to be closer to me. Unfortunately, staying safe from COVID has meant Dad has not had the chance to explore the neighborhood or make new friends here. He will be fully vaccinated next week. It seems like a good opportunity to start venturing out. So how can we safely expand our bubble?
So there, I think it's a little easier, because fortunately it's April and not January. So the weather is going to get warmer and warmer. And I think some walks in the neighborhood, some conversations with, one or two people outside is reasonable. It's easily safe. On the other hand, not that he would do. I'm not sure going to a Cubs game right now, if the stadium's full, would be the first step I would take. So I would start with that kind of slow situation. If there are family, friends, and there's something in a backyard or something like that, I think that's how you can begin to make friends. Also, in many communities, depending on where you are and what's going on, they should check with some of the local community, local Ys or local senior clubs. They are doing some hybrid activities on Zoom and some in person in terms of music and bridge and other kinds of games. So I would encourage that, but I would be very cautious and slow about doing it.
Sure. Dr. Schulman, do you have any advice to Andy on how to help his father settle into this new community?
You follow the guidelines, and I think we're not talking as much about basic hygiene issues that we talked about at the very beginning. You're okay if you're sort of maintaining a distance, if you have your mask, and if you do good hand hygiene. You should be able to get out and go for a walk and talk to your neighbors over a fence and things like that, and introduce yourself and commiserate and talk about the weather and just have some social interaction and maybe a few rays of sun for your vitamin D level. It's actually a good thing to do. And that's where I would start, just with the admonition. If you don't go up and give people hugs and shake hands, that's still not the recommendation. So, you practice the appropriate distancing and hygiene and don't rub your eyes and, just be careful. But it's good to start. It's good to explore. Our numbers in Chicago have, we see little ebbs and flows with our numbers. Our hospitalized patients in ICU have been sort of low, steady but low. We're not out of the woods yet, but I think that this is an okay time to actually go for a walk and meet the neighbors and say hi smile to people. If you smile with your eyes somehow, make a connection.
Right. I just want to reintroduce our guests. I've got Dr. Robert Schulman, a psychiatrist with Rush University, and Dr. Linda Murray, a physician who spent her career in public health, and also Diane Slezak, who works with Age Options in suburban Cook County. Dr. Murray, we're getting some questions about vaccination. One viewer is asking, can the vaccine adversely affect the body's natural immune system in any way, such as triggering an autoimmune response?
So first of all, we have many vaccines, and in this country, as you know, the FDA has given emergency approval to 3, but around the world we have similar vaccines, and I'm sure the audience is aware of some of the recent holdings on Johnson & Johnson's, etc. So let me answer it this way. From what we know at the moment, all 3 vaccines are safe, even though we've suspended Johnson & Johnson for a minute while we investigate this clotting problem. There might be an autoimmune reaction that happens once in 2 million times or something like that, and we may not have seen it yet. So for me to sit up here and say absolutely not, I think would be a mistake. But from what we can tell, the reactions that we've seen to the Moderna, the Pfizer, and even the Johnson & Johnson are very rare events. And I personally, as a physician, am not particularly worried about it. I think the key thing people have to understand is that we've done these clinical trials to see how effective the vaccine is. But if we have, just like with the clotting that we've seen with the Johnson & Johnson, if we have an event that is so rare, even though we may clinically test 50,000 people in a clinical trial, but if it happens once every million or 2 million shots, you may not see that early. So people should be confident that these vaccines are extraordinarily safe, especially compared to other vaccines. They're all much, much safer than getting COVID. So let me just say, COVID as a disease caused clotting many times more than what it looks like the Johnson & Johnson vaccine may cause clotting. So I think people have to have some sense of perspective. It's scary because it's a new disease and there are new vaccines and there are many things we don't know. But just to remind people, women that have taken birth control pills, for example, have clotting as a side effect much more frequently than we've seen with this Johnson & Johnson vaccine. So right now, I'm not worried about any major autoimmune problem. I'm not promising that one may not show up later, but right now there's no proven autoimmune complication.
Well, Dr. Murray, what if a person has a vestibular problem, could the vaccine cause dizziness? And if it does, what could they do about that?
Again, I have not seen any major connection with these vaccines and dizziness. Let me make this suggestion. When you get a vaccine, it is possible, and I encourage all of you to do it and find out about it. The CDC has a app that goes on your phone where they text you every day or so, and you write down, you report what your reactions are. That doesn't mean that all of those reactions are related to the vaccine. Okay, right. Just because you get a shot today and you have a headache tomorrow, it doesn't mean the headache comes from that shot. But this is the way we can all help keep track of any possible side effects. Then they have all of that data from across the country and they can analyze it to see if there's anything unusual going on. So that's the first thing people can do. The second thing is if you find an unusual symptom after you have the vaccine, you should contact your primary care physician if you have one, or contact a physician and go and see it, because again, people are still going to have the normal problems and diseases that they have, even if COVID wasn't around and even if they didn't get a vaccine. So some people are going to get dizzy and some people are going to have other problems. And so to be really safe, you should seek medical advice and get checked out.
So, thank you for that answer. I want to pivot to how to get the vaccine. I'm going to ask Diane first. We've got somebody watching on YouTube who says, I am homebound. How can I get a vaccine? Let's start with the suburbs.
So if you are in suburban Cook County, I can share a link with you later. We have a new link that just came out today where you can complete a questionnaire online. And if you have a loved one that could do that with you, also many of our local care providers can help you to do that online. There's also a telephone number you can call. And I could either give that to you now or you could post it later, and then you get put into the queue and you will receive a call. We do have in-home vaccines starting now in suburban Cook County. There are a couple of partners, several partners that Cook County Department of Public Health has, and all of our agencies that provide home delivered meals and in-home services are feeding names into their database and calling older adults to get them. I also want to emphasize that depending on how homebound you are, we have been doing vaccination centers for older adults throughout suburban Cook County. We have one coming this Saturday in Franklin Park, but we've done 8 of them and we're still doing 10 where we vaccinate a high number of people in their cars. So these are people who, they might not get out very much at all, but they can get out to get to the doctor. They can get out to get a haircut or to do something like that. They might get out for a special family celebration. So if you can get them into the car to get them vaccinated, I recommend doing that because that is going to happen sooner. Each vaccinator can only vaccinate about 6 to 8 people per day. If you think about them driving from one house to another with the vaccine, it's a very slow process. So, and it's made slower by the fact that we're now not using Johnson & Johnson. So they need to take 2 swings past that home. So that is going to be a while. We have vaccinated people who are double amputees, who are stroke victims in their cars, quite a few of them. So,
yeah, Dr. Murray, what about where people can get vaccinated here in the city then, if they are homebound?
The city is doing some of the very similar things. Some of the community health centers are doing it. And again, I would contact first the city. First, I would start with, if you have a regular doctor, ask your doctor. That you may find that your doctor's office can send you someplace. But in any case, I would contact the city Department of Health, and there are a number of community organizations and community clinics and providers around the city doing home visits. As Diane said, that's probably the slowest version. So if there's any possibility of having people get into a car, that would be much faster.
Dr. Schulman, I have a comment from one of our viewers who says, I'm a care consultant in the field of aging and Alzheimer's. My organization's biggest challenge is getting care professionals to refer people for preventive services early on and not wait until there is a crisis. Our healthcare system is based on a curative model, not prevention. I would like to see more services like mine where preventive care planning is emphasized and people are empowered to better navigate the aging journey. Do you have any thoughts on that comment?
The person is absolutely correct. Everything that was stated, that we are a reactionary medical system. We're still driven by procedures and such, and we don't really take as much of a prevention model. I think that some of it is economic in nature. Some of it is, who's the payer, what's covered, what's reimbursed. Older adults have, government-sponsored insurance at this point, and, what they will pay for actually has a big role in what services might be available to older adults. But the statement of early intervention is absolutely correct. It's hugely important to have somebody visit the home for safety considerations and see if there's any sort of occupational therapy interventions that can happen in the home to help prevent bad things from happening. It's very much appropriate to have socialization activities as a prevention of further decline for mature adults. And, it's a change of culture in many ways to get this to happen, the shift to a prevention model as opposed to a reactionary disease-based model.
And we really need parity for behavioral health services.
Mm-hmm.
So, right now, if I have chest pain, there are all kinds of programs and medications and everything. But, if I lose a partner where one can predict I would need grief counseling and some support, we don't routinely do that. So I would love to see parity between our mental health and behavioral health services on an equal footing with our physical health services.
And Diane Sleaze, sorry, go ahead, Dr. Schulman.
I was going to thank Dr. Murray for that point because the lack of parity was actually, I hope no government regulators are listening in, but the lack of parity was institutionalized with the way Medicare reimburses for certain conditions. If a primary care doctor actually puts down depression as a reason for a visit, it's a primary diagnosis, the primary care doctor will get reimbursed less of what they would get if they would put down high blood pressure for the visit. So there was stigma and non-parity and bias built into the reimbursement system by the government. And that sort of started it and has continued and such. So parity would be nice. Parity for not just psychological or psychiatric conditions, but social conditions as well that contribute to the mental health and mental well-being of individuals would be a very important thing to build into this as well.
Diane Slezak, do you have comments on this too?
I don't know that I have anything to add. I completely agree with what's been said. I think we often wait, even with hospice care. People don't get into hospice until the very last minute. I think the average is 3 days before people pass away or some small amount of time. And that's just the pattern of a lot of things. It's, they just don't make use of some of the interventions in time or, soon enough.
Well, I'd like to stay with you, Diane Slezak. We've gotten recommendations of organizations and services from people who are watching, and it reminds me that so often we, again, wait for this crisis to begin, just like what we've been talking about. What do you think seniors and their families, when should they begin looking at what is available in their community?
Well, Before we leave you, I do want to answer that question, but pivot just a little bit, because we do have quite a range of virtual programming going on right now that anyone can take advantage of. And I'll send you the list later, but
Great.
we're doing things like memory cafes where a caregiver and their care partner can both attend a memory cafe together, either online or they can both get on the telephone. And it's just a fantastic way to get involved. And many of those memory cafes are available to anybody in the area.
Can you explain what happens during a memory cafe? I'm not familiar with this.
So each of our memory cafes are different. And when I send you the link, you'll get an idea of some of them are based around music, because music is such a fantastic way of connecting with older adults whose memories are depleted, or who are having memory loss issues. Some of them are based around cultural issues. Our Hanuel Korean American community has a memory cafe, and it's very much based around some of their traditions and some of their cooking patterns and things like that. So each one of them is different. And I'll just send you that link so that you could take a look at each of them. We also have our Thrive with Pride cafes. And I think when you think about people who are LGBT and older, that population could be particularly isolated and at risk during this time. And those Thrive with Pride cafes can be used by anybody on, in the listening area. I can send you the link for that, and we'd be very happy to recruit additional members for the memory cafes that we have occurring throughout the area. We also have a number of faith-based programs where people from various congregations gather together online and do some programming around helping to support caregivers, in particular, helping them with coping strategies and sometimes hands-on techniques of caring for older adults, how to lift someone at home if you're isolated, how to care for somebody that's come home with a new surgery or something like that. We also have our Sounds Good Choir Good Memory Sing-Along that just occur on a very regular basis. So we send out those notices. And then telephone topics is something that we partner with Mather Lifeways cafes on. And there is a calendar set out where there's 4 or 5 different topics on either just fun topics about Chicago history or suburban history of various communities. And you can log on to any of those just by phone or in some cases on your iPad and listen. And then there are a number of other virtual programming activities that we have supported through North Shore Senior Center and one of our other local senior centers. So, there's a pretty rich array of things. And I agree with Dr. Schulman that and Linda, that if you could just get out and take a walk, that's terrific. But some of these options might also be useful.
That is a lot going on. That's a lot. Dr. Murray, I have a question from one of our viewers, Elizabeth, who asks, with the explosion of the variants now contributing to the rising cases in Illinois, is there extra concern for breakthrough infections in fully vaccinated seniors?
I think she's asking about with the new variants, right?
Right. Yes.
So what's going on right now in the United States, though, I will say I don't think I would like to see this going on more, but to the extent that we're testing the new variants that are coming out at the moment, it appears that all 3 vaccines that we've authorized in the United States are effective against those variants. There's no so viruses mutate all the time. This is what they do. It's not a surprise, and this will continue. So there's no guarantee that a mutation next December might not be covered by these vaccines, but we're trying to watch it not only in our country, but around the world. But I will say this, and I hope your listeners will help fight for this. To the extent that only rich countries like the United States vaccinate its population and the poorer countries in the global south are not able to do it, that's a place where variants are produced quickly. So if we really want to attack this problem in a logical way, we would have a vaccination plan that makes sense for the whole world. It's really a shame that we have whole portions of the globe where even healthcare workers who are taking care of sick people are not vaccinated. So if we want to address variants, we have to have a widespread vaccination and do it in a much fairer fashion than what's presently going on.
All right, and I'd want to note that we have dropped a link to the memory cafes in our comment section. So if you'd like to take a look at that, feel free. It's right there. And I have a question for Dr. Schulman. Initiating a conversation with somebody who you feel needs help to continue in living independently, that can be a very difficult conversation. What can you do to make that conversation a little bit easier?
It's a good point. We've had those discussions before, and I have to tell you that my father, we talked about him earlier before the show, was a psychiatrist. He actually wrote a book called How to Survive Your Aging Parents. I think he wrote it for us so that we could start having these conversations, because I had a similar conversation with him about his car keys that I actually quoted from his book. And there was smoke coming out of his ears that day, let me tell you. But you do have to approach it, and you do have to do it in a kind manner and a friendly manner, and cherry coat it as much as you can. And you just say, Mom, Dad, you start with a question. Don't you think things are getting harder? We know, it's, you don't want anybody in the house and such. I mean, aging is essentially, you can look at it as a series of losses. There's loss of family, friends, sometimes physical integrity, loved ones, sense of productivity, a sense of self, and then towards the end, there's this loss of independence. And it's a tough issue, but yeah, tough conversations in the long run are going to pan out much better than avoidance. And so you just approach it with kindness and say, look, your safety, we love you so much. Your safety is above everything. And you may not like it. And the person's not even going to work for you. They're going to work for us because we're concerned. And so this is a way that you start approaching it, and you can do it piecemeal. And, Diane will have plenty of resources for you to access, to actually help bring experts in, to at least they can meet your parent and sit down and talk to your parent and do an assessment with your parent to figure out what kind of services they really need to stay in their own home for as long as they can.
And don't wait too late. Don't wait till your parent might need the help. So, for example,
don't wait till they fall.
Right,
get in there.
exactly.
Right?
So as both of my parents have died, but as they were aging, I made sure that I involved my son and his wife in discussions with my parents about exactly what Dr. Schulman was talking about. What about driving? What about people in the house, etc. So that they were younger, obviously, and they didn't really want to be involved. I said, no, you need to be involved because one day you'll have to have this conversation with me. So having those conversations early, long before they're necessary, become important. And it allows, so my grandchildren, for example, think I shouldn't drive because I drive too slow. They can't, they're new drive, but that's their attitude. So what I say to them and what I say to my son in this, I say, one day I may not be able to drive. I shouldn't drive one day. And I'm going to delegate your father, my son, to make that decision. When he tells me that, I'm not going to argue or anything, and I talked about how I needed to move around, etc. So having the conversation, hopefully a decade or two before it's necessary, I think makes it easier on the whole family.
Yeah, I have a list from my mom who said, if any of these things happen, it's time for you to take charge. So that's good that we had that she initiated that conversation.
But some, again, will really rebel.
Right.
Some older adults, and it's that loss of independence that they will feel most greatly out of this. And so there really needs to be a heartful discussion about safety and what's best and how it can be worked out. And like with any negotiation, you start with 24/7 care, and maybe you work it out to what they might agree with, right? So it's tough. It can be heart-wrenching, but like Dr. Murray said, earlier is better, and you just have to jump in and do it.
And I
I
don't want to
agree.
forget Sister Brooks. There are people who don't have the resources to do some of this stuff. We need to collectively, as a society, make sure we provide those resources. If we have senior housing, we need to have the care and the staff there to help those seniors. So that becomes important too.
And I agree. Since the pandemic, all the sort of help that one would have, the social workers and types of services that one would get in senior housing, it's been so much more difficult to provide, and it's further isolated individuals and made it difficult to access the sense of safety. And I really admire how Ms. Brooks and her neighbors tried to band together and support each other. And that's really kind of what it takes, to get through something like this. Everyone has to pull together.
Yes, they do. And we have come to the end of our time for today. And I want to thank you so much, Diane Slezak and Dr. Murray, Dr. Schulman, for joining me. And thank you to our viewers. I'd also like to thank Devetta Brooks once more. Thank you for taking your time today. And of course, thanking my mom. Thank you, Miss Elaine Labez. I promise I'll get a haircut real soon. We're going to drop a link to a survey in our comments. And if you'd like to take a minute or two to tell us what you thought about tonight's program and what you would like to see us talk about in the future, we would very much appreciate it. And if you are eager to get outdoors, take the doctor's orders, get outdoors, you can join us for WBEZ's virtual 5K during the month of May. It's right around the corner. Our Curious City team is providing inspiration on places in Chicagoland that you can explore. You can walk or run, whatever you like. Take your bike if you want to do that. You can follow the link in our comments and learn more, or you can head over to our website, wbez.org/events. And I hope you join me tomorrow at 10 o'clock for our midday programming block on WBEZ. That's 91.5 on your dial, or you can stream on 91.5 WBEZ and WBEZ.org. Thank you so much for being with us today. Have a wonderful evening. Bye.